is Miranda Cox. I am a PGY1 here at ETSU Bristol. A normal day for us, one of the reasons that I went into the program, it can really vary by rotation. I'm currently on PEDS-ER, so this morning I actually had the opportunity to wake up. I went and seen all the babies in the nursery. Typically then I will go to clinic after that, and then I'll head over to the ER in the afternoon. I think we have an awesome work-life balance. One of the reasons for that is probably how the residents work together. So we run two essential 24-hour services. We have a 24-hour family medicine inpatient service and a 24-hour OB inpatient service, which I think makes us a pretty unique program. However, that's split among the residents. Intern year, you work a few more hours than the others. However, I think it's still very reasonable. It's a great opportunity for learning. I just switched a call with a colleague a few minutes ago. If you have an important life event, colleagues are always willing to help you out and switch calls. I think the training is excellent here. People really look up to Bristol and the other Tri-City hospitals. I'm from Southwest Virginia. I think that we see a lot of diversity, we see a lot of underserved people. And I think that the program here, you get a lot of experience in OB, and just about anything that you want to see you can probably find at Bristol. So I love how my apartment is just located across the street. So it's pretty cool. You're still in a rural area, you're surrounded by the mountains. You can drive just a few minutes down the road and be on the Appalachian Trail, but at the same time you also still, as we kind of start to open back up during pandemic times, you have the Pinnacle right across the road, so you have lots of shops and restaurants to be able to go and hang out with your fellow residents after hours. I think that they should rank Bristol as their #1. I think that being in the Appalachian area, you're able to see a lot of underserved patients. And even though we're a larger hospital than some of the small acute care, it's kind of the Goldilocks program, not too big, not too small. And so you can come here and get lots of experience, whether you want to work as a hospitalist afterwards in a rural primary clinic, or do a little bit of women's health. I think that any sector of medicine, you'll be able to practice in a broad field as a family medicine doctor.